Part 3 of Chapter 8, Joints. Synovial joints are classified based on type of movement. Here's an outline of the ones we'll go over. Planar joint, also known as plane joint, P-L-A-N-E. Hinge joint, pivot joint, condyloid joint or condylar joint, saddle joint, ball and socket joint. So the first one here we're going to talk about is the planar joint, also known as plane, P-L-A-N-E joint. So this joint, the plane joints or the gliding joints have flattened or slightly curved surfaces that slide across one another, but the movement, of course, is very slight. So this picture down here is showing you, of course, that type of slide back and forth and side-to-side movement for the planar joint. On your PowerPoint, I think I switched these pictures around so they would be with the actual joint name. So I apologize, but I did not correct it on this slide. So an example of this one, of course, is going to be your intercarpal joints. Some other examples would be the vertebrocostal joints. Your sacroiliac joints would be another type of plane joint or planar joint. Okay, your hinge joints, of course, are located up here. The hinge joints permit angular motion in a single plane, so they like opening and closing of a door. So, of course, they permit, of course, only flexion and extension movement, such as the knee joint and the elbow joint. So what happens here is you have convex surface of one bone fits into the concave surface of another bone. So it's only allowed to go in the two different motions. Next, we have our pivot joint. Okay, and this is, of course, showing you one here with the head of the radius and the radial notch of the ulna. So the pivot joint permits only rotation movement. So the surface of one bone articulates with a ring formed partly by another bone. And of course, the joints that enable the palms, of course, to turn anteriorly and posteriorly is the example. Another example would be of a pivot joint would be your axis and your atlas. Because the atlas rotates around the axis, it allows you to shake or pivot your head side to side to say no. Next, you have your condyloid joint, also known as your condylar joint. They have an oval articular face nestled within a depression on the opposing surface. And you see that drawing here. But the projection of one bone fits into an oval-shaped depression of another bone. And we give an example of the wrist. So it allows your flexion, of course, your extension, I'm just abbreviating it here, your abduction and your adduction movements. And again, the example of the condyloid joint, of course, is the radius and the bones of the wrist of the carpals. Your saddle joints, of course, they have articular faces that fit together like a rider in a saddle. So you hear the rider, then the saddle down here. So each face is concave along one axis and convex, of course, along the other. So the saddle, you have articular surface of one bone is saddle shaped and the articular surface of the other bone fits into the saddle. An example of that would be your thumb joint. So this one is going to allow your movements of your flexion, extension, your abduction, your adduction, and of course your rotation. Your ball and socket joints, of course, they're going to, it's like a ball-like surface, of course, or the head of one bone is going to fit into a cup-like depression of another bone. So the examples of this would be your shoulder joint and your hip joint. So with the shoulder joint is the head of the humerus, of course, articulates in that glenoid cavity of the scapula. And with the hip joint, you have the head of the femur, which is showing you here. That's going to be articulate into that acetabulum depression here, and the acetabulum is of the hip bone. It's also going to allow flexion, extension, abduction, adduction, and rotation. So both the saddle joints and the ball and socket joints are going to allow flexion and extension, abduction, adduction, and rotation. Again, this right here is just showing you a chart that summarizes the characteristics of those synovial cavities, the articular cartilage and the articular joint capsule. So it kind of gives you a little bit of examples of all of those, or summarizes it for you. Range of motion refers to the range measured in degrees of a circle through which the bones of a joint can be moved. Here are some factors that contribute to keeping the articular surfaces in contact and affect the range of motion. So you have actually six that we're going to go over, 6 factors. So the first one here, of course, is the structure or shape of the articulating bones. The shape of the bone determines how closely they fit together. So the articular surfaces of some bones have what they call complementary relationships. So they allow that interlocking fit, which is going to allow rotational movement. Number 2, the second factor is strength and tension, of course, of the joint ligaments. So ligaments are tense when the joint is in certain positions. Tense ligaments restrict the range of motion. Also, they direct the movement of the articulating bones, of course, with respect to each other. The third one here is your arrangement and tension of the muscles. So the muscle tension reinforces their strength placed on a joint, of course, by its ligaments, and thus restricts the movement. So an example of this one, of course, is when the thigh is flexed with the knee extended. Movement, of course, is restricted by the hamstring. This right here is your the fourth one will be your contact of soft parts. Soft parts could be adipose tissue, they could be muscles. So it is the point at which one body surface contacts another may limit the mobility. So movements may be restricted, of course, by the presence of adipose tissue. So an example of this would be an arm flex stops when pressed against biceps brachii muscle. The fifth one here is hormones. Flexibility, of course, may also be affected by hormones. So there is a hormone produced, of course, by the placenta and the ovaries called relaxin. Relaxin increases the flexibility of the pubic symphysis and loosens the ligaments between the sacrum and the hip bone towards the end of pregnancy. And what that does is it allows it to permit expansion of the pelvic outlet, which assists in the delivery of the baby. The sixth one, of course, is going to be disuse. That is the movement that may be restricted if a joint has not been used or moved for an extended period of time. An example of this one would be when someone has a cast on their arm and they have it on there for a while. They don't have much restriction of that joint. So you may have a temporary limited range of motion at the joint due to the limited movement while the arm was in the cast. Next, this is an outline on some selected joints, more particular selected joints we're going to talk about. That is the temporomandibular joint, which is known as TMJ, your shoulder joint, your elbow joint, your hip joint, and your knee joint. So the temporomandibular joint, of course, this one is combined hinge and plantar joint formed by the mandible and the temporal bone. Okay, the only movable joint between the skull bones is your TMJ joint. The mandible is going to move. So the mandible, of course, is the only bone in the skull that moves. Movements that it's going to do is elevation, depression, protraction, and retraction. And it shows you, of course, a picture of it here. Okay, our next one, of course, is the shoulder joint. The shoulder joint, of course, has the greatest range of motion, and I'm abbreviated to ROM, range of motion. So it has the greatest of all the joints, the greatest range of motion. So it connects the upper arm to the scapula. So the ball and socket joint is formed by the head of the humerus and the scapula, the glenoid cavity. It has more freedom of movement, of course, than any other joint of the body. This joint, of course, has 5 major ligaments, of course, that help stabilize that shoulder joint. Also, the rotator cuff muscles help stabilize that joint as well, too. They work as a group to hold, of course, the head of the humerus in the glenoid cavity. Movements of this shoulder joint, because it is a ball and socket joint, would be flexion, extension, abduction, adduction, rotation, and hyperflexion as well too. Okay, this picture right here is just showing you, of course, this picture right here is just showing you the lateral view where you can see how small the articular cartilage of the glenoid cavity is compared with that of the articular capsule. This picture over here shows you a frontal section through the glenohumeral joint that shows the relatively loose articular capsule, how it extends from the scapula to the anatomical neck of the humerus. So that oversized articular capsule is going to permit an extensive range of motion. The elbow joint, of course, this one, of course, is a hinge joint that's formed by the humerus, the ulna, and the radius. Of course, that works similar, of course, to the hinges, of course, on the door. So you have that two-way movement. You have the flexion and the extension movement. Okay, next you have a hip joint. That is a ball and socket joint formed by the femur and the hip bone. So the movement here is going to be circumduction, flexion, extension, abduction, adduction, rotation, sometimes hyperextension. So in complex synovial joints such as the knee, a variety of structures provide support and additional stability. So you have the knee joint here. That's going to be the largest and most complex joint of the body. So this is the one that I have you make sure that you can label. So it does have the two-way movement of flexion and extension because it is a modified hinge joint. You should be able to label your quadriceps tendon, which is here. Okay, and that's the tendon of the quadriceps muscle. It attaches, of course, to that base of the patella. And then down here you have the patellar ligament. You need to be able to label that as well. It extends from the apex of the patella to the tibial tuberosity. On a previous slide, we talked about the tibial and the fibulocollateral ligaments. You should be able to label those. And let's see here on that. That's all on these pictures. Okay, on this slide, of course, the knee joint, you should be able to label the posterior cruciate ligament, the PCL, and the ACL, which is the anterior. And they're named, of course, after their location. So they attach the intercondylar area of the tibia to the condyles, of course, of the femur. And they're named, of course, after their position. So the anterior one is going to be in the front, posterior is going to be in the back or behind the anterior. So you should be able to label that as well too. And also you on this picture label the fibular and the tibial collateral ligaments. Those provide the lateral support for the joint. Be able to label the bones, fibula, tibia, and then of course the condyles, the lateral condyle and the medial condyle. The menisci, medial and lateral menisci, that's these little pads here. They act as cushions and also are going to provide stability, of course, to the joint. Okay, here are some selected joints of the exoskeleton that you should know. And just pretty much, I don't make, the classification and the movement on these, but just the components or where it's located at. The sutures, of course, you should know those are between the skull bones. Vertebral, those are between the vertebral bodies. The atlantoaxial, because that's between the dens of the axis and anterior arch of the atlas and between the lateral masses of the atlas and axis. The atlanto and occipital, because that's between the atlas vertebra and the occipital condyles. The sternocostal, because those are between the sternum and the first 7 pairs of the ribs. Make sure you know those. On this one, you need to know the sternoclavicular, the radioulnar, the sacroiliac, the pubic symphysis, the tibiofibular, because we talked about those. mostly. Those are the main ones I want you to know, of course, where they're located. Oh, and the acromioclavicular. So aging, when it comes to the joints, you have the effects of aging on joints are influenced by genetic factors. They can also be affected by wear and tear and will vary from one person to another. So aging may result, of course, in decreased production of synovial fluid. The articular cartilage becomes thinner, ligaments shorten and lose some of their flexibility. Osteoarthritis is partially age-related, usually at age 70 or over, but will vary from person to person. Stretching and aerobic exercise are helpful in minimizing the effects of aging. They help to maintain the effective functioning of ligaments, tendons, muscles, synovial fluid, and articular capsules. And then, of course, you have degeneration of the joints, which changes can start in the 20s, but usually much older in the 80s. Okay, so arthroplasty. These are joints may be replaced surgically with artificial joints. Most commonly replaced are the hips, knees, and the shoulders. Joints, of course, that have been severely damaged by diseases such as arthritis, of course, may be replaced. Hip replacements, you can have a partial hip replacement, which involves only the femur, and a total hip replacement, which involves both the acetabulum of the hip bone and the head of the femur. And they can use artificial devices, plastic or metal, for the hip replacements. Knee replacements, of course, can be partial or total as well too, but you have actual of resurfacing of the cartilage and may be partial or total. Potential complications of arthroplasty include infection and blood clots, loosening, or dislocation of the replacement components and nerve injuries. Okay, so this right here is showing you, this first picture is showing you a preparation for a total hip replacement. You can see the lines, of course, where it's showing you where they're going to be reshaping the acetabulum up here, and the head of the femur is going to be removed. So you have the damaged parts of the acetabulum and the head of the femur are going to be replaced by artificial devices. And this is showing you some components of an artificial hip joint, and this is showing you an X-ray of one. These are showing you some artificial shoulder device, an artificial knee device, and an artificial hip device. So they can, have implantation of the artificial joints such as these may be the method of last resort when regular exercise, physical therapy, and anti-inflammatory drugs such as aspirin fail to slow the progress of arthritis. So these artificial joints can restore mobility and relieve the pain. People who undergo, though, these joint replacement surgeries will have lifelong restrictions. For example, high-impact activities such as jogging and running and playing football are no longer allowed after a hip or knee replacement. New knees and hips, of course, can last for more than 15 years, especially if the patient follows restrictions and avoids high-impact joint stress and strains. Okay, this picture right here is showing you the new separate artificial replacements. And this is showing you how they place them on the D. Define TMJ, that's your temporomandibular joint. It is a combined hinge and plantar joint by the condylar process of the mandible and the mandibular fossa and the articular tubercle of the temporal bone. Remember, your condylar process on that mandibular bone is also known as your mandibular condyle. Define dislocation. That is the displacement of a bone from a joint with tearing of the ligaments, tendon, and the articular capsules, usually caused by a blow or fall. Tennis elbow. This is where you have pain on or near the lateral epicondyle of the humerus. That is usually caused by an improperly executed backhand. So what happens is the extensor muscles are strained or sprained, resulting in the pain. And of course, the knee joint is the largest and most complex joint in the body. Arthritis, of course, is inflammation of the joints, so it's where the joints are swollen, stiff, and painful. define rheumatoid arthritis. That is an autoimmune disease in which the immune system of the body attacks its own tissues, like the cartilages and the joint linings. Define arthralgia. Of course, that's the pain in a joint.